So like as Jason mentioned, today I'll be presenting on the topic of ankle instability following an ankle sprain. My last clinical placement was at Orthopedic Foot and Ankle in Falls Church, which gave me a great opportunity to work with a variety of foot and ankle diagnoses. The reason I selected this topic was because I found very little literature on the topic of ankle instability for post-surgical patients with chronic ankle instability. So to start off with, lateral ankle sprains are the most common sports-related injury occurring in 80 to 90% of athletes, of which 70% of those will suffer a recurring ankle sprain. So lateral ankle sprain is defined as a mechanically induced pathology occurring where the ankle rolls inward, stressing the lateral ligamentous complex, which is composed, as you know, of three primary ligaments: the anterior talar fibular ligament, the posterior talar fibular ligament, and the calcaneal talar fibular ligament, named based on the bones they attach to and from. And the grades can, of course, range from grades 1, which is a mild form of a tear, to a grade 3, which is a severe or complete tear of the ligament. So according to current literature, ankle sprains can alter the sensory motor joint control, which is your body's motor and sensory inputs ability to maintain your balance. So with that, you have, or as a result, there is an increased response latency of the muscles, and increased joint instability. Some other joint-related ankle sprain sequelae include decreased sensation, decreased range of motion, decreased strength. The inadequate strength and response latency put patients at greater risk for recurring ankle sprains, which warrants the use of functional rehab programs such as neuromuscular training to address and improve their proprioception and dynamic ankle stability. So neuromuscular training was selected as a primary interventional method in this case report, based on a systematic review from the Journal of Medicine and Science and Sports Exercise, which underscored the value of using proprioceptive neuromuscular training in treating sports-related injuries, especially those who are especially injuries which are reoccurring, which is very applicable to my case report. In addition, neuromuscular training was also supported in the use of prevention and decreased incidence of common sports-related injuries in younger adults and athletes in higher risk sports like pivoting sports like soccer and basketball. Neuromuscular training programs vary, but oftentimes include factors or components that focus on core stability, lower extremity strengthening, agility training, plyometrics, and stretching. So the purpose, or considering all the evidence that I presented, the purpose of the case report was to examine the effects of a 6-week neuromuscular training program on improving ankle stability and mobility to therefore improve common gait and balance deficits seen in post-surgical patients with chronic ankle instability. So the focus of the case report is TC, a 24-year-old female. She is a cheerleading coach and a kindergarten teacher in the Fairfax County Public Schools. She lives with her husband in a multi-level townhome and socially enjoys shopping, volunteering, and running, all of which were impacted by the injury. The patient had a good surgical outcome and prognosis, which led me to believe she would be a good candidate for neuromuscular training to address and again improve all her deficits. The patient, who had a history of chronic ankle sprain, suffered a grade 3 ankle sprain while landing incorrectly while demonstrating a cheerleading stunt with her team. This resulted in persistent right ankle instability, pain, swelling, and tenderness, which really impacted her functionally. She later underwent an ankle ligament procedure known as a Bronstam Gold procedure to repair the damaged lateral ligament. Oftentimes, it's the anterior talar fibular ligament that's involved with the sprain, just because of its location and size. So the first image here just again shows a mechanism of injury, which is with the ankle rolling inward, stressing the lateral ligamentous complex. And with the surgical procedure, the surgeon goes in and repairs the injured ligament in the short end position to give the joint more stability. In addition, the ankle retinaculum, which is connective tissue, which supports the tendons of the foot and ankle, is also reattached to, again, just reinforce the repaired ligament. So in this case report, I also use the ICF model to, again, help identify how the ankle sprain impacted TC's ability to participate in her environment, and also help me as a therapist identify what factors I need to address for her to return to her prior level of function and meet her goals. So as some of the impairments highlighted, important impairments highlighted in the graph, in the diagram, include her decreased range of motion, strength, and balance, which limited her ability to participate in walking on uneven surfaces, negotiating stairs, and cleaning. Some of the participation restrictions included her inability to exercise, volunteer, and attend social events with her colleagues and husband. So the patient's primary goals were to be able to sit cross-legged and short kneeling, to be able to interact with the kids, the kids in her class, walk on uneven surfaces, to be able to take her class out to recess because she had to walk on mulch, which is quite challenging for her at the time. Climb stairs to access the classroom and her bedroom, since she lives in a multi-level home, and then be able to land jumps successfully after a cheerleading stunt. So in this case report, the neuromuscular training was provided over the course of 6 weeks for 20 minutes out of each 45-minute treatment session, and included a variety of balance exercises to really address and improve her impairments. The outcome measures in this case report included the foot and ankle ability measure, single leg stance, which were assessed at initial evaluation and every week thereafter. In addition, mean muscle testing, range of motion, and gait were also analyzed throughout the case study. So each weekly session included exercises that focused on addressing postural stability, strength, and plyometrics through use to help TC reach her goals and return her to her prior level of function. Based on her age and prior level of function, she was challenged each week with change in resistance, repetitions, and advancing to more challenging activity as well. So by the end of the 6th week, the patient's foot and ankle ability measure scores, her ADL scores went from 34% to 72%. Again, based on her ability to negotiate stairs and walk on uneven surfaces, and get into the cross-legged and short kneeling positions. Her sports subscale, which is also another component of the foot and ankle measure, went from 0 to 20%, based on her ability to, based on her improved jumping tolerance and her ability to participate in cheerleading. She did mention that she did have decreased endurance and form, which is something she continues to work on. Her single leg stance went from 5 to 5 seconds with moderate to severe pain and swaying to 28 seconds with no pain and minimal to no swaying. The other improvements were gradual improvements were range of motion and strength, which correlated well with her functional ability and gait pattern. So these graphs, again, just demonstrate the positive linear regression with all the outcome measures. Just to point out, her self-score, which is also another component built into the foot and ankle ability measure, was initially 40% and went up to 80% at the end of the 6th week, which again kind of agrees with in agreements with the other outcome measures. So the results of the case report demonstrate the positive effects of a 6-week ankle-specific neuromuscular training program on improving ankle stability, immobility in post-surgical patients with chronic ankle instability to help return them to their prior level of function. The results also support the hypothesis of incorporating proprioception into your neuromuscular training program to help decrease the recovery time and decrease the risk of re-injury. So what does this all mean? So oftentimes a focus of post-surgical rehab with ankle patients is on improving range of motion and strength, delaying the need to address balance until patients are fully weight-bearing. So by doing that, that again puts them at risk for re-injury and can delay their recovery process. Again, as mentioned, because of the altered sensory motor joint control. So based on the outcomes of this study, and based on the outcome of this case report, utilizing a comprehensive ankle-specific neuromuscular training program, when put in post-surgical patients, can help improve their outcomes and should be an interventional approach that should be adopted. So that's it. Any questions? Okay. Yes, Sky.
For the outcomes and for your intervention, so you had 1 week. Was that the first week you saw them, or was that 1 week post-surgery?
So we saw her at 6 weeks after surgery. So initially she was non-weight bearing, was in the boot. Right. So she came.
I was very shocked.
Yeah.
Biometrics 1 week after surgery.
Yeah.
I was like, wow, this is a new protocol.
Other questions? Yep, the one back there.
Go ahead.
Maybe I missed it, but did you say what the reasoning for the surgery was? I mean, I guess she had a pretty extensive tear, but did she try rehab before the surgery? And if she did, do you know what that consisted of?
Well, her surgeon recommended surgery just because she was so functionally limited by the injury. It was a severe grade 3 injury, sprain. So her surgeon recommended surgery just because she had a history of chronic ankle instability. So the joint integrity itself was lacking. So that was just the best option for her based on her and her surgeon. Yeah.
Dr. Lau.
Did you do any therapy?
Yeah, well, like I mentioned, the neuromuscular training program was 20 minutes at each 45-minute treatment session. So the other time was obviously manual therapy and other approaches we commonly use. So yes, we did use manual therapy.
Obviously.
That adding the neuromuscular has not been done previously with chronic ankle instability post-surgery?
So again, my main point was incorporating proprioception into the neuromuscular training program. That was the biggest point of what I was looking for to see if that was influenced the outcomes in post-surgical patients. Did I answer your question? No. Okay.
All right. Thank you, Mohammed.
Thank you.